Following are instructions for you, the patient, to use in order to obtain maximum benefit from SockIt gel. SockIt should have been applied at the time of your procedure at the dental office, and the syringe with the remainder of the gel should have been sent home with you. If you don't have the syringe of SockIt, you need to call your dentist and go back to the office and pick it up because you need that gel to use for the next 2 or 3 days. You need to apply SockIt at least 4 to 6 times per day until the syringe is empty, which usually takes 2 or 3 days, so apply it every 4 hours or so. And you can use it more often if you need for pain relief. It's non-toxic, there are no drugs, so it's very safe. So that first day you'll be using it mostly for pain relief, but you need to remember to at least use it every 4 hours or so. SockIt provides 3 important benefits. First, it helps provide pain relief without causing a numb sensation. Second, it helps to prevent microbial contamination. And third, it helps to promote optimal healing. Using SockIt is very easy, it's common sense. Unscrew the white cap from the syringe and then screw on the curved tip. So very simple, and you want to use the curved tip because it helps you to reach in back areas of the mouth if you have, for example, a molar extracted in the back of the mouth. And also the opening at the end of the curved tip is smaller, so it helps to reduce waste. You want to use just enough gel to cover the affected area, and then keep the tongue away, keep your finger away, leave it alone, don't displace the gel, let it stay in place and work. So it's real easy to use at home. And when you're finished applying the gel, remove the curved tip, rinse it very well, and replace the white cap on the syringe, just common sense again. And retain the remaining SockIt and curved tips for subsequent application. Just place it in the bag and place it where you know where it is so you use it in another few hours. Store SockIt at or below room temperature. It's okay to place it in the refrigerator, but don't freeze SockIt. It is safe to use SockIt and prescription narcotics at the same time. So prescription pain medications like codeine or hydrocodone are safe to use with SockIt. But try using SockIt first, because quite often the use for pain medication is diminished or it's eliminated completely. So use SockIt first. If you need to use some pain medication, the prescription medication, then go ahead and use it at the same time that you're using SockIt. There are no medical, pharmacological, or age restrictions associated with SockIt, so no matter what your diagnosis or whatever medications or how old or young you are, SockIt is safe to use. After a day or so, when discomfort has diminished, you still need to remember to apply SockIt every 4 hours or so to continue getting the benefit of protecting the wound and the optimal healing it provides. So again, you'll use it the first day or so for pain relief mostly, but after that you still need to continue to dress that wound every 4 hours or so. If you have any questions regarding the use of SockIt, please go to our website, sockitgel.com, or you can call our 800 number, 800-755-0044.